Good morning, everyone. A press conference is underway in Calhoun County concerning what they called their first positive COVID-19 test there. Let's listen in.
Was that it was difficult to talk about making change before we had a case in Calhoun County, and that we didn't have all the answers. So one of the things that I'm most proud of is that the county Board of Commissioners has been very supportive in granting our leadership team some administrative ability so that we can act quickly when necessary to protect our employees and to take steps throughout county government in all of our departments to protect the public. So we did make the decision on March 16 to suspend walk-in abilities to interact with county departments and get essential services for the most part. We realize that there are essential services such as public safety, public health, and other critical items that our residents still need. And so we have tried to provide remote opportunities for citizens to still get county services, online opportunities. Most of our departments are still available right now by phone, and we realize that, as you've heard, this is a quickly changing situation, and so county leadership continues to evaluate the term essential services. So we urge all of our residents to check our website. We have done, I think, a pretty good job of providing updates and communications. We realize that communication to the public, even though we're all encouraged to be physically separated, that connection and that communication is more important than ever right now. We've established regular conference calls with the other local units of government, including the school districts, the cities and townships and villages. And just a couple of examples of services that are still being provided, at least for now. The county treasurer's office, while some of us talked about March sadness with no athletics going on, they are very much in March madness. This is the time when people that have delinquent taxes are approaching the deadline of March 31st to pay those taxes to avoid forfeiture of their property. So our treasurer's office, our emergency management services worked with the state to get some relief on property taxes. So you can still pay your delinquent property taxes, but we've been able to work with the state to get some relief and extend that deadline. I'm also very proud of the fact that this community, as we have seen in the past, when there's a local emergency, has come together. So the county government is just one part of a lot of organizations that are now being asked to be leaders. So as individuals, we're being asked to do our part, and as an organization and as an employer of more than 700 employees, the county is trying to provide that leadership. And other organizations such as our local foundations, our fitness centers who are streaming live workouts so that we can try to keep healthy and safe. The chambers of commerce that are encouraging us to support local businesses who are trying to survive given the recommendations that we all stay home. So it's been very encouraging to me, and I think that we knew that at some point Calhoun County would have a coronavirus case. I hope that we use this as a positive opportunity to really take seriously what the federal government and what the state is recommending, what we've been saying, but again, I think change becomes easier sometimes when it's real. So for me right now as a county leader, for our employees, we're trying to encourage us to do our part to not add stress to others in this stressful period, and to rely on each other to communicate and to stay connected with the community so that we can get through this. And I just want to reassure you that the county government are still here. We are still trying to provide those services. We're trying to communicate, and we're happy to be part of a community that will pull together and get through this. And I'll just leave you with what our mission statement is, which is to provide to build a better community through responsive leadership. And I think with that, we're ready to open the floor for questions.
Actually, I just had one final comment. Thanks, Kelly. We did want to get out there where you can go for more questions. Certainly our social media pages, Facebook, MDHHS coronavirus, michigan.gov/coronavirus, The state hotline, if you have questions, they're manning this 7 days a week, 8 to 5. That phone number is 888-535-6136. And so with that, I think now we'll go ahead and open it up for any questions.
You said the person who tested positive, they have no history of traveling outside, so they got it somewhere in South Michigan, is that what you think?
There's no international travel and no travel outside the state of Michigan. So correct, the person who has COVID-19 disease was exposed in Southwest Michigan.
Can we say if they're, do you know if they're a male or female, or can you?
We're going to communicate by saying whether a case is an adult or child, and then all of that more specific information is going to be compiled on the state health department website. It's updated at 2 p.m. so everyone can see what population the virus is most affecting.
So we're not saying age either, we're just adult or child?
Correct. As a smaller community, we strive to protect the confidentiality of our Calhoun County residents.
So now that there's a positive case in Calhoun County, do we expect the numbers to increase as rapidly as they have in other places?
So I'm going to repeat the question so everyone can hear. The question was, now that we have a positive case in Calhoun County, will that increase the number of cases in Calhoun County? I think we should expect to have more cases among Calhoun County residents, particularly given the fact that the exposure here was within Southwest Michigan and not with international travel or outside travel to the state of Michigan. And it just underscores the point, given that fact, underscores the point of why social distancing is so important, why washing your hands, why covering your mouth when you're sneezing, why following the governor's executive orders, following local public health recommendations, staying home if you can, particularly for a high-risk individual such as an older adult or have an underlying medical condition.
How is maybe the health department, or kind of backtrack then, since this person got it from Southwest Michigan to, you know, are other people they came in contact now quarantined? Like, how does that all kind of work?
So the question was, what's the process for public health investigation? So local public health departments routinely provide what's called contact tracing. So first we receive a positive laboratory result or a report from a concerned clinician or physician in the community. And then we follow up both with the physician or healthcare provider and also the individual patient themselves to gather more information to learn when they were actually had symptoms, so we can make a determination for what's known as exposure. And we define close contact as those who have spent prolonged period of time with somebody who is less than 6 feet away, or someone who has directly sneezed in someone's face or coughed in someone's face. That would be defined as a close contact. With that information, we then, if we identify those folks who have had close contact with a defined case, we make recommendations for either self-isolation, which is folks staying at home and not going to work or school, or we can also monitor for symptoms as well, depending upon what level of exposure has occurred. So those are often made on a case-by-case basis.
So several steps have already been taken to promote social distancing, closing county buildings. Now that there is a positive case, are there any additional steps that are being taken?
So you are correct. The county has suspended most of our in-person interaction. The courts have also taken steps based on the Supreme Court's recommendations and orders to drastically reduce the number of jury trials and interactions the public need to have. I think that we believe that we have already taken the necessary precautions. We continue to watch what the state and the CDC recommends, and certainly if there are further recommendations for businesses, for employers, for organizations, or for this community, or for the state in general, we may need to take additional steps. And we do continue to stress to our department heads and elected officials that the idea of providing essential services needs to be balanced with our goal of trying to allow as many of our employees to stay home as possible. So we have provided remote working arrangements. A lot of the business can still be done by phone, and so we're hoping to continue to provide those essential services as a key part of the community.
Any questions on the phone? Is anyone even still on the phone?
Yeah, I can take a moment just to bring up, I think, a question that's on a lot of people's minds, which is about testing. A lot of folks have questions about how can I be tested, should I be tested for COVID-19 disease. So for the first point, a clinician or a healthcare provider makes the decision to order a COVID-19 test. And overall, as we've experienced in our community and on the state level and national level, it's been a very challenging and also frustrating experience to provide the testing to be able to detect cases in our community and across the state of Michigan. And there are a couple layers there of the challenge. One is there needs to be adequate testing supplies to actually perform the test. And the second part, and then there has to be adequate diagnostic laboratory to then perform the test. So we have been partnering closely with our local health systems about current status about testing in our community, as well as throughout the state of Michigan. There are 3 avenues for diagnostic laboratories. There's the state public health laboratory. Second, there is the commercial laboratory that can be sent out. And the third, there is a hospital in-house laboratory to perform testing. Depending on local health systems, depending on where you live, there are variables that are all existing at this time. So your local emergency management team, your local public health department are all partnering with the state of Michigan and with the federal response to begin to increase the amount of testing that's happening in our community. Because it is very important to be able to detect cases, because that informs those critical public health decisions from removing someone from a social environment and to help reduce the spread.
Do you think you guys have enough testing available to you right now? Can you repeat the question?
So I've been asked to repeat the question. The question was, do we have enough testing supplies at this time? No. Well, we need more testing supplies, both in terms of swabs and the type of collection device that's needed. And we also need increased laboratory capacity, and those are both needs at this time.
And do you think the testing is going quick enough? I know you guys said earlier there were still 28 pending. Is this getting done at a rate that we're comfortable with?
I think there is momentum, but there needs to be substantial more investment in testing.
I know you guys mentioned this a little bit, but the last thing, if you could just kind of, like you mentioned, we don't want to put fear out there. Just if any of you could just kind of reassure the residents about how you guys are being run and how they're moving forward.
Okay, do you want me to repeat that question? The question is, what's the, to repeat for the public out there, what are we asking them to do, I think is basically the question. And we can't stress this enough. It's okay, we're going to get through this. But do what we know we've asked, and we've been, and what the public health experts have said, and that is wash your hands for 20 seconds. Practice social distancing. Try to stay 6 feet away. We've tried to show some level of social distancing here. It's hard sometimes when we have to be on camera, but we spoke about that, and we are all going to go wash our hands as soon as we're done with this today. Little things like that make a big difference. And I also would like to say that we need to support our local businesses. You know, we have a lot of restaurants right now that are takeout only. If you can, please do. We have a vulnerable population. We need to check in on our neighbors. And if we do all of that, we'll come together as a community and we'll get through this. So, you know, with that, if there's no other questions, I think we can be done. Thank you.
All right, everybody, if you're just now joining us, Calhoun County officials just updating the media saying that they have their first positive COVID-19 case in the area. We do know it is an adult person. We do know the person is an adult, rather, with a travel history in Southwest Michigan only. We're not sure if that person is a man or a woman. That information has not come out to us yet. But authorities are also reminding people to heed the warnings from government, local, and state government officials in terms of knowing how to protect yourself. They want you to practice social distancing to hope continue to stop the spread of the coronavirus. But we do know now that there is a positive COVID-19 case in Calhoun County. We'll continue updating you about the spread of this virus online and on our broadcast as the information becomes available to us. Thanks for joining us. We'll see you here later on this evening on Wood TV at 6.